Hey there, good evening, and welcome to the Bronx Buzz. This is Bronx Net's program where we talk to reporters and writers and editors and filmmakers. And in our second segment, we're going to be talking to a Grammy Award winning folk singer. And I'll explain why that's relevant here for the borough of the Bronx. But to start this evening, we're going to talk to the health reporter for Gothamist and WNYC. It is my pleasure to welcome Caroline Lewis to the Bronx Buzz. Nice to have you.
Thank you for having me. Yeah.
Let's just get started. You haven't been on our program before. Let's just talk a little bit about your background, where you're from, how did you get into journalism, what inspired you to say, I think I'm going to do this.
Well, I'm actually a native New Yorker. Went to public school, in the city. And My dad was a journalist. He taught journalism at York College for like over 30 years. So, I obviously had a little bit of inspiration. My mom was the editor of Library Journal, which is like a library publication. But I think I always just thought it was a cool job. You get to talk to so many different kinds of people. You get to speak truth to power. And I've always had a lot of different interests, but I became a healthcare reporter for Crane's New York Business, where I really learned so much about how the health system works. And now I get to write about that for more of a general audience, at Gothamist and talk about it on the radio for WNYC, which I find really rewarding.
And if, you talk about truth to power and, we talk about, you ain't got nothing if you don't have your health. When you look at the foundation of what we all need, I guess you're really getting to the grassroots of the grassroots if you're talking about our healthcare. And of course, the last 2 or 3 years, we really have had a lot to talk about, um,
Yeah.
to say the least.
Right. There's always been these really stark, inequities in the city when it comes to health outcomes. Your
Yeah.
how long you live has to do with the zip code you grew up in, that kind of thing. But I think that those inequalities just became a lot more clear to people during the pandemic.
Yeah, there's no question about it. Plus, we had kind of a curtain raising. It's like the Wizard of Oz. Ignore that man behind the curtain about our health systems and where they work and where they don't work. But anyway, so we're gonna go one step further back because in order to get good health, you need good food, and you have written really, I think, some extraordinary pieces, very eye-opening pieces on food insecurity. An article you wrote in June talked about food insecure New Yorkers feel the squeeze from rising grocery prices. It's very interesting. We talk about food insecurity, we talk about the pandemic, we talk about a lot of factors, but how much of an impact has inflation, the rise in grocery prices affected New Yorkers and exacerbated what has been, frankly, a very thin system to begin with?
Well, we first, really saw visits to food pantries and soup kitchens spike in, spring of 2020 for obvious reasons. People were losing work and income. And the number of visits to those pantries actually increased, reaching a high in 2021. But then we saw those numbers go down a little bit. And I think the increase that we've started to see again this year is really what people who are working on hunger are attributing to recent inflation. Food prices have increased about 10% over the past year due to inflation and also other global factors. And even more so in grocery stores than in restaurants. And so people are saying, that definitely is contributing to these, food insecurity remaining a major issue.
And you know what I learned? We did a program with Friendly Fridge, and the Friendly Fridge people. There are some in the Bronx. There was one that was kind of closed, and that was disappointing. And one of the things that is very clear, there's one on 242nd Street and Broadway, right under the L, the last stop of the number one train, and people who are working come off that subway stop and go to the Friendly Fridge to get food for their families, and that to me is upsetting. It's scary in a way, but it's very upsetting because here are people with jobs and there's not enough money. And I guess not only the minimum wage has to come into play, but what you're saying about grocery prices has got to be part of that, right?
Yeah, absolutely. I mean, I think one thing that's important to keep in mind is we do have programs like SNAP and WIC that are supposed to give people money to buy groceries so that they're not relying on pantries and kitchens or fridges, like you're saying. But for one thing, not everyone qualifies. Like if you are undocumented, you might not. So if you have a household where some people are, documented and some people are not, you might not get as much money in SNAP. And then, with inflation and with all these other factors and prices rising, that money might not go as far. Um, and it's not something that's necessarily going to get better right away because people have actually been getting supplemental SNAP payments during the pandemic that could expire soon.
One of the things that you wrote about and you actually mentioned right here is the comparison between a rise in grocery prices versus a rise in restaurant prices.
Mhm.
And what is apparent is that it's the rise in grocery prices that's larger. And that, in a way, to me, that's surprising because restaurants have to purchase food, have a staff to prepare it and present it, et cetera, et cetera. Do we know why that is? Or is it just one of those things that's going to have to be unraveled by the various economists?
I mean, I'm not a food economist, so
Fair
I
enough.
don't know exactly why that is, but I do know that a lot of like grocery staples have been impacted, by things that have been happening recently. Like even, there's been an avian flu outbreak that's affected the price of poultry and eggs. For a while there was Russia was putting a blockade on wheat exports from Ukraine, and that was affecting the price of cereal. So some of these are things that might be temporary, but then there are also sort of longer term issues that are definitely affecting costs.
You began to explain kind of the line graph of, okay, so very logically, numbers of people needing food assistance rose during the pandemic. I mean, that was a whole literal crisis. But then you say it came down, and that would be logical as people figured out how to do things, got back to work a little bit, et cetera, et cetera. But then the most recent article you wrote about said that I'm going to give the headline: traffic at New York City's pantries and soup kitchens remains high this year, 68% above pre-pandemic levels. And so what that would suggest is we didn't get back to where we were.
Right.
Um, Gee, Caroline, solve our problem. How are we going to help? I mean,
Yeah.
and I'm joking, of course. This is a major, serious thing because it's the foundation for for everything. Kids in school. I mean, on and on and on.
Right. I mean, I think one of the most alarming things actually is that there's been a real increase in the number of children whose families are relying on food pantries and soup kitchens. I think the figure was, a 75% increase in visits to, these resources from children since, compared to before the pandemic. And so that's something that, that's a real issue. And I think relying on pantries and soup kitchens is not really a solution.
Yeah,
Everyone I
that's,
speak to.
which is funny. We're using that as the barometer, but like, goodness gracious, we don't really want to, we would like to have a kind of a normal, food system,
Yeah, yeah. I mean, these are operations that are largely volunteer run. They're relying on a lot of donated food, some of it coming through City Harvest.
Yeah.
But then also, when they are, purchasing food or getting it through private donations, they're squeezed as well. The food pantries and the soup kitchens are also feeling the effect of inflation. So maybe they can't give people as much food, with the same donations as they could before. And so people who are working on hunger definitely want to see longer term solutions from the federal government. There's going to be like an upcoming White House convention on hunger that I think a lot of representatives from New York City are going to go to and try to demand more permanent solutions.
Child tax credits is in that dialogue as well, and it makes me think that, and I'm not very close to all of the numbers, but support systems that were put in place to deal with the pandemic, many of those things are expiring now, and so people, to me, what that 68% says to me is that as a society we have not fully recovered.
Right. I mean, it's not just the increase in food prices that's affecting people's inability to buy food. It's the fact that the moratoriums on, eviction ended. The fact that
Oh yes, that's right.
credits
That's right.
expired. When you have to pay rent, and you don't have a choice, then maybe you say like, okay, I can't buy food. Maybe I have to go to the food pantry. The cost of gas went up. So it's really all these different things that are affecting people's food security.
And so, where do we see solutions? Is this putting an association of groceries together? And in a way, I'm seeding the clouds for our next segment, which is going to be talking about the Riverdale Sunday Farmers Market, as well as a special presentation there, which will include why hunger out there. So that'll be our second segment. But is are the local um, farmers markets the answers? Is it putting, the Stop and Shops and ShopRite and all those, and even Target that sells groceries together? How do we deal with it? Or is it not a food solution? It's a poverty solution, and then we got to look at the minimum wage.
I mean, I think it's a lot of different things, and I am, maybe I'm not the best person to ask this question, but a
You
lot
are
of
the best
people.
person to ask.
I mean, the thing is, like, I think that there are probably a lot of innovative solutions. One thing that people have brought up over and over again is that, if people are eligible for SNAP, they should be enrolling, and there's not always enough outreach done to make sure that people
Ah.
who are eligible for SNAP know about it, or who are eligible for WIC, just for women with children, know about it. And so there's definitely a push to have, a larger enrollment effort to make sure people are enrolled, to make sure that the, federal government continues to give people more money through those programs. Like, certainly having the flexibility to spend money on whatever groceries you need, as opposed to, having to go get food from a pantry is preferred. But I'm sure there are also other solutions related to, easing inflation, and maybe creating cheaper options for people and that sort of thing.
We're just about to run out of time. What you have just suggested opens up another whole can of worms. And
Mm.
sitting where I sit and having these kinds of conversations all the time, the communication issue becomes a systemic problem because of the various fragmented elements of society, people with language differences, people with documentation problems. There is a home, certainly, what is it, 10% of New York City school kids, come out of a shelter system. That impacts the ability to just like blast social media with snap information,
Right.
because people are elsewhere. Plus, the language thing is a major thing. Anyway, listen, we got to run. Caroline Lewis, we'll keep reading you. Gothamist, WNYC. We hope you will continue to cover, as well as you have been doing, um, fundamental issues like this. Thank you so much.
Awesome. Thank you so much. I appreciate it.
Great. We are going to take a break. We're going to talk about, in many ways, the very same subject. And that just happened kind of coincidentally that we put the two segments together. We're going to talk about hunger with a Grammy award winning folk singer, and talk about how he's coming to the borough of the Bronx to really help us eat more and feel a little better about ourselves. We'll take a break.